This is our presentation on gun deaths by suicide in America by A.J. Gross and Will Chrisman.
The NBC News national poll found that 52% of Americans say that they or someone in their household owns a gun. Using data we found from the Suicide Prevention and Resource Center, we found that 53% of the suicides in 2020 were by firearm. According to PreventFirearmSuicide.org, more than 23,000 Americans die by firearm suicide every year, and 64 people die by firearm suicide every day.
These stats directly correlate and show that this method of suicide is used most often because it is one of the most easily accessible ways out.
Our solution to help lower the number of firearm suicides is to create a system of government-funded therapeutic help centers in areas with high firearm suicide rates.
At first, we would offer a grant to the top 5 states where firearm suicides are most prominent so we could implement these centers there. We will then observe the data and see if it makes a significant impact. If it does, we will expand farther across America. According to PewResearch.org, the top 5 states in America most affected by firearm suicides are Wyoming, with 22.8 deaths per 100,000 people, Montana, with 21.1 deaths, Alaska, with 19.9 deaths, New Mexico, with 13.9 deaths, and Oklahoma, with 13.7. Tanya J. Peterson from ChoosingTherapy.com reports that about 90% of people say they have better emotional health after therapy, and around 67% of people report an improved physical health.
This data is important because it shows us that if we can make therapy easily available, fewer people will be affected by firearm suicides. According to Mental YC, it costs on average between $5,000 and $10,000 to create a private therapy center. If we open 10 centers per state for just the first 5 states, it will be roughly $100,000 per state for the centers alone.
After we implement the grant money into the spending, it will be about $1 million per state, amounting to a total cost of $5.5 million. In order to raise the funds to cover this $5.5 million, we would have to raise federal taxes by about 0.055% for a total of 1 year.
If our solution is implemented, our hope is that it will significantly decrease the number of firearm suicides in America, and it will aid people who are struggling to get the help they need. Some people might argue that this is not a necessary solution since it only targets one aspect of suicide prevention, and there is already a suicide hotline and other establishments to prevent suicide across the country.
Public opinion may think that the tax raise is unfair because even with these other solutions, the rate is still high and our solution might not make that much of an impact on these numbers.
Our goal is to work alongside these other organizations to ultimately decrease the number of suicides, and with our solution only targeting the majority of suicides, which is by firearm, we hope to help eliminate the main cause.
We believe that our solution is the most viable and will be more effective in helping people based on the therapy statistics that we had pointed out earlier.
In just the first 5 states that we are targeting, we hope to decrease the number of firearm suicides per 100,000 people in each state by 5. The new numbers that we are aiming for are 17.8 in Wyoming, 16.1 in Montana, 14.9 in Alaska, 9.9 in New Mexico, and 9.7 in Oklahoma.
The main impact that we aim to have on the community is to help people better their mental health and lower the rate of firearm suicides.
According to the Centers for Disease Control and Prevention, the economic toll suicide has on society is huge. Suicides and suicide attempts cost the nation almost $70 billion every year.
Lowering firearm suicides across the country will decrease this number and will benefit America's greater economy. We find this very important because firearm suicides is a very serious problem in America today, and it affects many people very negatively.
Thank you for listening to our presentation.